let's talk about blood urea nitrogen, aka BUN. So, reference range 5 to 26 milligrams per deciliter, internationally 1.8 to 9.3 millimoles per liter. Your BUN is a byproduct of the breakdown of proteins. Let's be more specific. Muscle tissue, right? So when you break down, the body makes 20 times more acid than it does base. When it's just going through its daily activities willy-nilly, minding its own business, it will make 20 times the amount of acid than it does base. Therefore, one of the main duties of the body to remain in balance is to make sure that it makes a lot more base. We'll talk about how it does that a little later. For the purposes of this particular part of the conversation, um, one of the ways it makes so much acid is breaking down muscles into proteins, into amino acids. Okay, so therefore, low levels of BUN may be indicative of low levels of food intake, which may lead to the body breaking down muscle tissue, therefore causing weakness. And by the way, the proximal convoluted tubule of the kidney hates to be touched by broken down muscle. It will be damaged. It is exceedingly, exquisitely sensitive to some things. One of those things are acidic components like this. Um, you can use the BUN levels to point out severe liver insufficiency, overhydration, especially decreased protein intake, and then increased BUN may be indicative of an impaired renal function. Right? You're going to have patients that come in, and you can have one of three problems with the kidney. You can have a pre-renal problem, a renal problem, or a post-renal problem. And it's really cool to look at the numbers when you're looking at your BUN, and you can basically look at the ratio between um, uh, the creatinine and BUN. You can look at the ratio between those and figure out where the problem is before the kidney, in the kidney, or after the kidney. I think it's pretty cool. Um, Increased levels may be indicative of impaired renal function, congestive heart failure, right? CHF, everybody remembers that. Right-sided signs, left-sided symptoms. Your patient's going to stroll in. If they have right-sided signs, that means they're going to have things like collection of fluid in the extremities, right? We're going to have edema, right-sided signs. Maybe their head bobs back and forth when they're just sitting there letting their heart beat. Maybe they've got jugular venous distension. Left-sided symptoms, which by the way are going to come first. Uh, why? Because right-sided signs, what I mean when I say right-sided signs, is that right-sided heart failure carries with it signs that are visible by the clinician. Left-sided symptoms are things that are experienced by the patient. Left-sided heart failure symptoms are, for instance, hey doc, the only way I can sleep at night is by putting three pillows beneath my back because I need to sit up. Every time I lay down and try to go to sleep, I feel like I can't breathe. That's called pillow orthopnea, right? And you'll write that in your SOAP note. One pillow orthopnea, two pillow orthopnea, three pillow orthopnea. They'll also tell you, doc, I gotta somewhere around 2 or 3 in the morning. I got to get up and go to the window and open up the window and just stand there and breathe because I feel like I can't breathe. Okay, remember, you know it. The most common cause of right-sided heart failure is what? Left-sided heart failure. What did I just say? You have every reason to chase down left-sided heart failure and resolve that thing before it progresses into right-sided heart failure.